Welcome to another edition of the Dental Growth Partners podcast. This is number 2. If you haven't seen number 1, go over and have a look. Don't forget to subscribe and like all our videos that we put out there, but what it will do is it'll make sure that you don't miss another one. So in this one, myself and Murray, we are going to talk about Facebook advertising and the sort of basic framework of it and how you deal with it after you actually get those leads. So, hi Murray, how are you doing?
Well, thanks. How are you?
Very good, thank you.
Got a nice tan.
Yes, had a nice couple of weeks away with the missus to get some brownie points for the rest of the year.
Yeah.
And raring to go for this year.
Yeah. So we've been using Facebook ads at the practice for a few years, and yeah, we sort of got them working much better over that time. And like Facebook's obviously linked with Meta, so you get the Facebook ads, the Instagram ads. You want to just describe a little bit what all the options are? It's quite a complex system.
Yes. What I'd like to do first of all is just sort of like, what are your thinking back those 2 years when you're first starting? You think, well, I need to start running ads to attract business in for different things like Invisalign and your orthodontics and jawing, but all those sort of general dentistry. What were your sort of thoughts then and the pitfalls and like, well, what do I do and changes and, your thoughts as a dentist?
Yeah, so as a dentist, I think you see a lot of stuff online. But the guys that you see are mostly influencers. So you sort of think that getting those like sort of high performing bits of content, and the content is gonna, I guess, because it's those bits of content are designed to be organic, whereas actually what we've kind of gradually come to understand is that you can get a huge like benefit from Facebook through paid ads. And actually, as a dentist, maybe this is like in some ways better because you don't have to sort of try so hard on the content to be, the volume, the high quality, the consistency of that to get traction with social media is very time consuming, very, very difficult. And so actually, like the paid ads is a way of getting your what you're interested in, i.e. attracting in people who are interested in those higher value treatments who are like out there looking for it. It's a way of getting yourself in front of them. So when we first started, we were sort of looking at sort of social media, like posting, like boosting posts, this sort of thing. So you're putting stuff that you think is quite well done, but you're then getting it seen a lot, but it's not actually sort of getting in front of the right people, and it's not getting in actual leads. It's just getting awareness, but is it actually converting?
Well, with something like that, funny what you said about boosting. When most people, 99% of dentists I've worked with, and I've worked with quite a few, and we've done millions of pounds worth of advertising over the years, is that the first thing, I already do the advertising. I press the boost button, I put £10 behind it, and it often, it does work, but you're not targeting anyone specific. It's a poor man's advertising, really. It does work a little bit, but you're just not getting your bang for your bucks, for doing it. What you need to do is go into the back end, into your business manager, Meta Business Manager, and then when you first go in there, you're like, oh my God, there's like all different sections and all that type of thing. That's why it's important to work with someone who actually knows what they're doing, because it's forever changing as well. Yeah. But you need to set out a framework for your adverts so every pound or dollar, whatever you're spending on your adverts, they're targeted to an audience. So it's very important to be able to target properly, and it's quite a minefield when you first go in and create your first advert. Like, I'm pretty sure with yourself, it's like, well, there's 6 or 7 options. What
so many options, yeah.
It's like, right, okay, so you've got awareness, you've got traffic, you've got leads, you've got conversions, you've got apps, you've got WhatsApp. It's like you've got all these different. It's like, well, all of those I could use, but take it from me, the only one you want to use at this time, and it has been for the last good few years, is lead forms, lead ads for things like your Invisalign. If you hire, you, you hire monetary bits and pieces you do, like your Invisalign, like your orthodontics, like your full jaw implants, like braces, all that type of thing. That's like 2, 3, 4, £5,000 per procedure. Lead forms. You want to get that potential customer's details as quickly as possible. Their name, their address, that. And with Facebook, you can actually create a lead form where that's put in front of someone. Advert first, then they think, oh, I like that. I'm interested in Invisalign. I want to, they've got an offer on about whitening or whatever it is, or kids' braces for that month, or okay, they go in the press, right, I'd like to see that. It comes into a lead form. They put their name, address, their telephone, their email, that type of thing. You can actually triage them down a little bit within the form, but you're sort of halfway there. They've shown an interest. You've got their details. You've got those details on file as well, even if they're a cold lead. You can heat them up by sending them emails and videos, and it's A to Z marketing really. So you need to have a structure. The structure is lead forms are the best way. What I would do I use 2 different types of Facebook advert, and Facebook is the most converting. It's better than Google Ads. It's better than TikTok. Facebook ads are the best converting ad out there, without doubt. You talk to any marketer, they would go, yeah, Facebook ads are the best converting. You get more bang for your money. Google ads are good, but the most converting are Facebook ads. So you need to be doing 2 things. You need to be doing brand awareness, which is a very cheap way of advertising your business. So all you're doing is you're telling someone, here we are, this is what we do, nothing special, you're not putting any bells and whistles on it. You're saying, this is what we do, we're a dentist, we're in your local area, blah, 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 come and check us out. If you haven't got a dentist already, we do Invisalign, we do this, we do that, all in one sort of little advert. And what it does, it just highlights the fact it's running in the background all the time. I normally run it for minimum 6 months when we first start working with any dentist, and it just throughout the area, 7-kilometre area normally is what I'd say. Anything more than that, you're sort of encroaching on other people's. You're crossing over, and people don't want to travel that far. So I would say 7 kilometres is your max, and you're putting out that brand awareness advert out there. And it's pennies. It's literally pennies per click, per people. And what happens is, it's just like if you could imagine you're watching the television at home, and you're seeing like an advert for BP petrol or M&S or whatever it is, and you're seeing that advert all the time. Every day you'll see it, and it's that type of thing where it's in your mind. You don't need to go to M&S, but when you do think, oh, I'd like to get some nice food. Oh, M&S. Or dentist. Yeah, I've got a toothache. Oh, I know. I'll go to Forever Dental Skin, or whatever dentist is running those brand awareness ads. So that's the first thing running in the background. But then you've got your lead conversion ads, and the way those work, and I mean, you've been in the back end of business, and it's quite bloody confusing, isn't it?
Yeah, I've been in there a few times and messed things up.
Things up a few times, doesn't it? Because most dentists I know, very intelligent people, I can do this. They go in there, and it's like, we'll copy that, we'll create this, and it's like, why does it just cost me £100 in advert, and I haven't got, it's all broken, and all that.
I'll get halfway through it,
and I get that because you're trying to learn it, and but it's like, honestly, you probably resonate with this. You go in the back of the business manager, it's like, what is all this?
And every 6 months it's changed.
It changes every week, more or less.
So you think you know it, you sort of gen up on it, and then the next time you check in, it's basically it's a different form, and like the way you did it last time isn't quite the way you do it. You got to try and refigure it all out. It's actually quite complex, quite hard work. You can figure it out, but then,
of course you can. You can figure it out.
It's then you've done that just for one potential advert, and then you've spent a lot of time just getting one thing done.
So many parts to the advert that you've got to have right, have correct. The first thing that stops people scrolling, because that's what you want to do. You're trying to people scrolling from, oh right, that's an advert, but I like the look of that. I'll press on that, learn more, or shop now, or whatever it is. Is the advert's got to be nice, not too exaggerated, brand colours perhaps, and an offer, or save this or do that, or a nice image where people are going to stop, or video. Now I like to put it separated into 3 areas. So you choose your lead forms. You want to separate into 3 areas, and you can build these areas up as you go along. So you've got what I call corporate images. Corporate images, which are you there with the lady with the
Invisalign bag.
you're holding the Invisalign bag. She's smiling, the young lady, and brilliant. That's more sort of lifestyle. So you've got a lifestyle. That's a lifestyle image, or a testimonial video, that type of thing. It's more lifestyle. Then you've got corporate, which you can download from Invisalign. Go onto their website, download that, and it's all crafted lovely, and it gives you all the information and everything else. I would use that as well. So you have 3 adverts within one. Third advert would be a video advert, which can be a testimony as well, or just it can be an Invisalign video, but testimonials work the best. Those type of things. So 3 sort of adverts: corporate, lifestyle, and video. If you incorporate those, one of those will resonate with somebody in some way. So that's your 3 sort of areas that you want to do for your lead forms. Then you've got things like headings and descriptions and parameters and all these type of things which come into it. If you can imagine you've got your advert, your sort of heading is what you want to make the most. You're trying to get someone's like, all right, something like Invisalign, it'd be like, whitening offer, or free consultation, or you're trying to give some value to get them to press that button, so you can take their details and then follow it through.
Yeah,
with
they
reception.
say it's like 80% of your ad spend is kind of spent on the headline, something like this.
Yeah, well, yes and no. It's your biggest grabber. But what you've got to imagine is the back end and the way the adverts work for Facebook. A lot of it's AI generated, so people think, "Oh, I'd like to use AI." You're already using it in Facebook in the back end, so you need like 3 or 4, 5 different headlines that you need to make up. You need 3 or 4, 5 different descriptions of where you're putting the bulk of the offer: free whitening, free consultation, free retainers, whatever it is. £1,000 off this month we're doing for Valentine's Day, whatever it is. That's where all your meat goes in your description, and your heading is you're trying to pull someone in, plus your visual or your video or your corporate image as well.
Because it does its own variation.
Yes, because the way we set it up is that you can put in 10 images, you can put in 5 headings, 5 descriptions, and what will happen is the AI will mix those all up. So you can have one heading with another bit of description with one of the videos, then you have the same heading with a different image and a corporate image. So you get hundreds of adverts going out there. And the beauty of AI within the Meta environment is that it's sending it out to Instagram, to Facebook, to WhatsApp, to Messenger, to adverts on videos. I mean, there's literally about 40 different placements. I would always say initially hit the Advantage Placements Plus button, because what it does, just sticks it everywhere for you. Yeah. Then what you do over the months is you go, well, I've never seen a lead from there. You can cut it down. You start making it with the data, making your buck work for you a bit more. Mm-hmm. You may, and it's quite interesting watching. You might get a string of like Facebook story ads of working, or you might get the Instagram or WhatsApp, or have you ever noticed when you've got a load of messages, things like that, you go about 7 down, there's an little advert there. You think, oh, what's that for? And it's the AI saying, well, you've been interested in Invisalign, you looked at something to do with that, we're going to put an advert in your messengers.
Is that retargeting? Is that what they, or?
That's part of the AI.
Okay.
So that's part of that Advantage Plus placements. Now, years ago, we don't want anything else but Facebook, maybe Instagram a little bit, but you just wanted Facebook. You didn't want side videos. You just wanted Facebook feed. That's it. Now, where the AI has come across and developed so well over the years, it's put it strategically all these different little places that you're looking on your phone and
So it's basically
that
doing
type of stuff.
its own research
It
on
is, and then
what people want and where they want to see it and what like ad is kind of the
exactly, that's
most
what it's doing.
attractive.
The AI is working in there for you. And one of the most common mistakes I see make is that you'll be running an ad for a week, and the dentist will go, "Well, I've only had one sort of lead from that," or wherever it's like. It takes literally weeks and months
Yep.
for the AI to work properly. The more money that's spent on your budget, the more adverts you've got running, the more videos, the more headlines, the more descriptions you've got. It's more for that AI to get its teeth into, stick it all out and go, well, that's working to 40 to 50-year-olds, male, who lives a mile from there. Right, we'll put more money towards that. We'll push that a little bit further. Oh, that's working. We've got 2 leads from that now. And it will actually move it all around and make the best of it.
Yeah.
You can do it also with the data. You look at the end of the month and you go, right, we've had all our leads from Instagram. Right, so what we need to do is put more money into Instagram, that type of thing.
Yeah.
And I suppose that's what's the difficult thing for as a dentist.
Yeah, I think that's the difficult thing, and definitely when we first started, like the difficult thing as a dentist is to understand how long it takes for that advertising to start bringing in like results, because dentistry is
Yes.
you can only afford to advertise the more expensive treatments, like say like Invisalign, orthodontics, implants, because they've got the margin where you can afford to spend some money on advertising to bring in the case, whereas a general patient, there's not really a margin.
Yeah.
It's more sort of, it's more routine. But it's kind of understanding that someone might be looking at ads for like 2-3 months before they then even like click on the clinic.
Yeah.
And then even when they go through that, it might be another 3 months before they commit to treatment. So it's this kind of extended lag time. Whereas when you first start working with a marketer, you obviously start paying the bills, start paying for the adverts, and you start paying for the service, and you kind of want to see quite
What's
quickly.
your results, don't
Yeah,
you?
you want results, and you want it to start paying for itself. But it's actually quite a delayed process on the bigger treatments, because there's this big sort of essentially consideration phase where people sort of thinking, I do need this, but I'm shopping around. Often people who kind of doing these things, they're very busy with work, like family life, etc.
Yeah.
So they also don't. They might be interested now, but they only going to actually start treatment 3, 4, 5 months later. In which case, you're not getting the money into the practice.
Exactly.
So this is the sort of just having a deep understanding of it means that you can sort of trust it more. But we definitely have seen when we sort of reduced the advertising, because we were sort of maybe going down more the posting and the content and boosting all that sort of stuff. Then when you do nothing, you definitely see the diaries get a bit lighter.
Yeah.
When you go back, we went back to a much higher ad spend. You see, in that sort of 6 months afterwards, then all the diaries are busier and busier and busier. So, but it's not always a direct ROI, or you don't know where that case has come from necessarily. They haven't necessarily clicked on the form.
Might be just a walk-in, mightn't it? It might be just a walk-in.
But they might be a walk-in, but they've already seen lots
seen,
of advertising.
Exactly. Yeah, that's
So then
subliminal advertising.
So I think that's also something that obviously you've got the lead forms and you do get direct leads, but we've seen in the clinic a lot of indirect interest, and that's maybe more difficult to
quantify, isn't it?
Yeah, more difficult to track, but you hear it in conversations that, oh yeah, I was thinking about it, but I know the clinic very well because I've seen lots of ads.
Yeah,
well, they don't say it like that, but essentially they've seen you
come up.
Seen you on their phone, etc., which is only for us coming through paid ads.
Well, the good thing also with that is the rest of the practice improves, like you're saying, doesn't it? Your general dentistry, which has nothing to do with the adverts you're putting out there, the rest, it's improving all the time. It's growing. It's a big plus. That's why we run the brand awareness ads as well for the first 6 months, as well as the individual ads. But a question I get asked a lot by dentists, and I remember you asking me as well, is how much ad spend do we put in? How much do we put in? And I would say a minimum, you start, if you're doing a high ticket item like your Invisalign, one of those pillars of the business, you've got to be putting in minimum £25 a day per advert to make it sort of the AI work properly, start building your list of people and triaging them down to make it cost effective, which is like, what's that, about 400, £500 a month
Yeah.
per
Line,
thing you
per line of treatment.
per line of treatment. So you've got Invisalign, braces, full jaw. You need to be doing 75 to £100 per day on ad spend, I would say, to make it really work for you. And you'll see the difference with your people taking up those offers. Maybe not straight away, like you said, but even things like Invisalign, you've got to go quite a way down the month or 2 months or 3 months before they start paying
Yeah,
for it.
and I think that's the difficult thing for maybe a practice owner who's not doing any advertising or just doing sort of they've got a presence and they've got like their list and they've got word of mouth, etc. So they're sort of ticking along quite well with that.
Yeah.
But to cross from that to then essentially spending thousands a month
Yeah.
on
It's quite scary,
ads
isn't it?
plus like management fees, etc. To then essentially have this lag time of 6 to 9 months potentially, but before you sort of see the clinic start to sort of grow and sort of actually pay you back for that. And I think a lot of people they probably get a bit anxious and a bit nervous in that sort of time frame. It's like 6 months. You start to think, oh, I've spent a lot of money here. Like, I'm not seeing the diary getting busier. I'm not doing any more of the treatments I wanted to advertise for. So then you start to sort of like get nervous basically that you're not it's not gonna work. But it's once you're then sort of doing it routinely, then I say that it's sort of like a rising tide. It sort of lifts all boats. Like all the diaries start getting busier, and it starts to sort of
associates
pay for itself.
and
And it's also it's because you're paying. It's getting seen so much that when you look at like if you post and boost post and then you boost, you might get seen like a couple of thousand times. When you pay for an advert, it's seen like 37,000 times in the local area. So
that's why it's imperative to work with someone who knows about Facebook ads. That's going to be your number one area of where you're going to get most of your leads from.
Yeah, and I think it's like the complexity one means that you can do a DIY approach, and like I would say like some dentists are gonna that's what they're gonna be comfortable with, but they're only gonna spend a couple £100 and like it's a dabble essentially. And you can't really go wrong, and you probably stick to the brand awareness type ad. But if you're gonna go after like expensive treatments, also you're in a competition then because other people have got people who know what they're doing, so you're also pitching yourself against
that's the thing
other agencies,
that's why I say like limit it to 7 kilometres where you put your adverts out to. That's your sort of your walk in, your people don't want to travel very far to be
we've seen that people don't want to travel more than sort of 15 to 20 minutes is like
that's it, maximum
for treatments that's going to take multiple visits, and they'd rather go with a different provider. Even if they love you, they'll prefer something like locality for busy people is an issue, and that's I guess just understanding that as a dental practice you are a local business. You're only going to attract people in from a certain radius, and if you're in a big city maybe they'll come a bit further as in travel with like public transport. But if you're sort of people traveling by car, they're sort of multiple appointments.
It's always everything's
20,
so
30,
busy and
30 minutes is like as far as they want to go.
So they that's why the takeaways are 7 kilometres, I'd say, no more than that really. You can go 10 kilometres, depends on the area you live and how many people live in that area, how affluent it is. If nothing else, if all you want to do is dip your toe in, run your brand awareness adverts. They're cheap, cheerful, and they'll give you a brand awareness in your area. To make it really work, you've got to be spending per procedure £25 minimum a day to make it really work for your Invisalign, for your kids braces, for your full jaw. Minimum that is per procedure.
And it's sort of like the pages. Obviously, that's the ads, but obviously you've got a Facebook page, you've got an Instagram page. Like, what would you say the kind of recommendations are on that? Is it critical to have like a outstanding Instagram page if you're going to do paid
Well,
ads?
that's the
or...
thing, you see. That, like we said in the very first podcast, there's two ways or one way of growing your practice. Now, there's going down the route of, famous doctor who's always on Instagram, great videos, smiling teeth, pushing out content every day, really crisp, really, and it works. It does work very, very well. But not every doctor has got the time for it. Not every doctor's got wants to be in front of the camera all the time, or getting receptionists to take videos of him and all this sort of stuff. That's one very good way of doing it. The other way is through adverts. The way we do it through adverts, through Meta, Google, TikTok, all that type of stuff. But if you can do both, wow, you've got a really strong marketing there for your business, because you're appealing to lots of different people. They're seeing lots of different things, because I look at some of these these doctor influencers, and I don't think they even need to do any dentistry anymore. So they're so famous with like 50,000 followers or whatever, just through Dr. George, I think is one, isn't it? Something like that, and it's a brilliant way of doing it.
But you said a lot of those, they've definitely got like a whole team.
They've got a whole team to do it. They're not doing it on their own.
They're not like
they've got a whole team. I mean, it's something we offer as well. We offer something like that where we come in every month and we do the video for you. We create the content for you. Your testimonials. You're looking around the practice. I think that's a prerequisite anyway.
Yeah.
For putting that on your website, for putting that in your emails, all this sort of content.
Because that helps your conversions, doesn't it?
Of course it does.
They're like essentially like what would be essentially described as brands is people getting to know you essentially in this like personal services world. It's people before they commit to a paid consultation to like spending money with you, they want to know that essentially reduce anxiety that they're going to get what they want. So the more you can they can watch you online and see exactly what you're all about. They can see inside the practice. They can see
exactly.
It's
trust, isn't it? It's that trust factor.
Running away like routinely, just doing what they want essentially or what they expect, and they can see that for a few months. Then when they actually want to go ahead with it, they're like, "Oh, I'll just join in. I'll go. I want to be sort of working with that person." And I think this is now. Like video is probably the most effective way of doing that.
It's the most highly converting way as well. Mm-hmm. People haven't got time anymore, So to see a video, something visual, telling them about, the practice or the doctor who's doing the Invisalign or the Invisalign or the patient who's happy and gives you a testimonial. It's like gold. It's it should be part of every dentist's marketing to get that that video. That's why. When we do our advertising for Facebook, we do the corporate, we do the lifestyle images, we do the video. So you're hitting all different aspects, all different people. That AI is making all that work with the headings, with the descriptions, with the putting it on a WhatsApp, putting it onto Messenger. You've got everything there to be able to be a successful practice as long as you spend the budget
and it's an ongoing ongoing process, because you said
an ongoing process. Yeah, you have to refresh that.
You say roughly every 90 days is your sort of
every 90
advice?
days. What I like to do is that what you'll get is something called ad fatigue. Normally about 90 days, you may see it start to drop off. You may not do. You may have created the perfect ad with the perfect everything in there, and you may just see a constant, influx of patients for whatever procedure it is. But what I find is you get a little bit falling off after about 90 days. And what we do there is we freshen it up with new videos, with new images, new corporate images, new lifestyle images, that type of thing. Reboot the AI into searching out the new customers and things like that. There's a few ways of doing that. I'll go into, I don't want to give away all the secrets of how you do it, obviously, but it's there's a few ways that you can
refresh it.
You can refresh it and reboot that advert, because the advert works.
Yeah.
The advert works. You don't want to chuck it away. You want to change some of the wording or things like that to make it the AI. What you're trying to do is make that AI think, oh, it's a new advert.
Yeah.
like that. Oh, I need to put this out to everybody again. So there's ways of doing that.
And you say like one of the key things is like the dental practice being able to give you as the person sort of running the ads, programming the ads, like the content essentially. So like the case studies, the testimonials.
That's
like,
it. You've
these are
got to
like
have that.
really good.
First thing I'd say whenever we go into any new practice, right? You've got to have part of your. It's very difficult because everyone's different, aren't they? And all your patients are different. But you've got to try and get as many testimonials as you can,
Yeah.
as many sort of still images with your Invisalign bag, or just a thumbs up when you're in the chair doing a procedure. Them silly little things. But make it part of your onboarding for that patient. Have a disclosure at the bottom. Just say, oh, would you mind having photographs? Would you mind having a video? That type of thing. Blah, blah, blah,
Yeah,
blah.
because some people, some as a dentist, some people are quite like
Yes.
quite willing to do it, and they might own their own small business, or they might sort of be in this space, and they know it's like it's something helpful for you, and if they like you, they're more than willing to do it.
Yeah.
Other people, they just like they're like, don't put me online.
No,
And they sort of
that's the bank robbers, isn't it?
very well, they're just very cautious about
Yeah.
that. One, it's the unknown. Two,
Yeah.
they don't.
Some people,
they're
respect
having
the privacy,
they're
don't
having
they?
something done. They don't want other people to know they're having something
yes.
done.
Yeah.
Because it's just not something they're interested to sort of broadcast. So it's really just being careful with that. But there are, when you ask, there are plenty of people in your practice as a dentist who are willing to sort of help you grow the practice. They want to see you being a success, and they're quite willing to help you.
The thing, the problem I find with which the dentists have is that you're rushing around doing so many things. It's like, oh, I forgot to ask them.
Yeah.
Got to ask them, get that. You've got to get in that routine of right. These are the steps that we're doing. We've got to look after the patient now. Let's try and get a photo if we can.
Yeah. Well, it's kind of that's where like coaching a team can make it, because when you're like, for me, I find it quite difficult to be like busy doing it. I'm happy they like it, but then it's like I'm in my sort of dental fixing the problem mode, and then it's like it's quite difficult to then go, oh, actually, you're quite good at. Do you mind like helping me out with the business? And it's like, oh, it's just like the wrong time at the end of the treatment. Whereas actually, if you're if they're sort of having a chat with the receptionist, and then they're like, "Oh, would you mind doing this?"
Yeah,
that's
like the thing. So
it's a different
training the team, and also it comes in with this Facebook ads, and any lead that you get from anywhere, you've got to. It doesn't just stop there. Oh, you get the lead, bum bum bum. Once that lead comes in, you've got to react on that lead. You've got to set up automations, which we do. We've got AI that speaks to the client, speaks to the customer. We've got email procedures that do different things that AI controls, and also the most important thing is your front of desk as well. Being able to speak to these patients and know what they're speaking. The TCO know what they're speaking about, helping that potential patient answer any questions, and it's a whole thing. It's not just get the advert. All right, yeah, I've got someone who's interested. Give you the lead. You don't look at it for 4 days. That lead's gone.
Yeah.
That's finished. You've wasted your money.
Yeah. I think you have to look at people who actually click on the ads as they're potentially interested.
Yeah.
And then your team has to be sort of highly motivated to essentially help people who are potentially interested in something that can help them.
Yeah.
And have that sort of like way of looking at it, that actually they put their hand up and said, potentially I could improve my life by straightening my teeth, and I'm potentially interested, and then you've got to give them more information to kind of help them sort of go ahead with it.
You've got to find the right time. But it's like,
if you look at it, sometimes there can be a bit of a sort of drop off, because it's like even in good results, you're not going to convert every lead.
No, of course not. No.
But then sometimes the team get a bit sort of disheartened. They're like, oh, it doesn't really work, and come to this kind of conclusion. But actually, it does work. Like it's just that a lot of people put their hands up and say, I'm potentially interested, but they're actually not suitable, or they don't actually have the money. They're interested, but so you've got to kind of help.
You got to triage them down with things like financials and how far away do you live and all these sort of things. But this is where AI comes in, and this is where we've incorporated something into FDS and everyone we work with, is that we have various systems in place that convert those potential patients a lot quicker than they normally would do.
Yeah, this is for small business, like really helpful, because obviously you've got a limited number of team members, you've got limited like ability to train people and sort of be in depth in every single process. So actually, like AI and these sort of triaging conversations, the more we can automate them,
Yes.
and just help the patients just work out if this is right for them
Yeah.
through automation rather than.
And what it does, it gets rid of the
staff.
time wasters, doesn't it, as well? It gets
Yeah.
rid of people who like the idea of it, but one, they won't be able to afford it, they've got the time, it's not a fit for them,
Yeah.
they're too far away or whatever. So it's sort of your triage with all these systems that we have in place. It's sort of, you get down to someone who's like, right, I want to spend the money, I want the Invisalign, I'm booking in for now, blah, 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 blah. You know, so it's not just the advert, it's the whole package that the practice needs to embrace to make it work and to build your growth and monetary aspect of your practice.
Yeah, and if you just sort of, if you're not advertising versus if you're advertising, there's a big difference in terms of what you can expect. Like if you're just sort of working on sort of word of mouth and people just sort of finding you locally,
well,
you can grow. But
word
it's
of mouth
very,
is brilliant. It's probably the best way of advertising word of mouth. But you can't scale word of mouth.
Yeah,
you know, you can't scale it. Oh, you're right. Yes, word of mouth's great, but we need to have 20 more people. There's no way of scaling that.
Yeah, so it's actually, yeah, it depends whether you, as a dentist, if you're sort of committed to, or you've got spare surgery space, or you've kind of got capacity within the practice to grow, then actually advertising is key in terms of accelerating that, and it's kind of getting comfortable with that environment where you have to commit to it, and it might be 6 months, 9 months before you noticeably seeing things lifting up, and then but once you're there, then you're like, okay, well, I'm quite happy now. This is like a comfortable amount that we're kind of happy to put into that. And would you say that there's sort of like rules of thumb in terms of like how much ad spend versus like the size of the business, their sort of industry?
I would say, I mean, this is what I say to all clients: is you need to be spending 5 to 10% of your turnover on ad spend, on advertising, whatever it may incorporate, Google, Facebook ads. 5 to 10% of your turnover minimum per month. So if you're doing, just say you're doing 20 grand a month, you need to be spending 2 grand on Facebook ads.
Yeah.
If you're doing 50 grand a month, you need to be spending minimum five grand. I would say.
Which I'd say a lot of like small business owners, they would sort of feel
it's like, wow, that's a lot of money.
Yeah, because it is a lot of money annually. In terms of, but that's then protecting your existing revenue because you're making sure that you're topping up with, you know, new people joining, new people using you, and you're always going to be losing some people who are sort of leaving or moving away.
Yeah.
So it's actually, although it's it's sort of a insurance nearly versus going quiet, which is like also a sort of risk if you're a small business, is if you're.
Well, the good thing about the way it is a thing for a practice, like, I need to invest £5,000-10,000 a month or whatever it is. It's like, it's a lot of money to risk without the trust and things like that. That's why we sort of, when we go to a potentially new client, it is for Dental Growth Partners, it's like, well, we've done this already with Forever Dental Skin and various others. We can show you the data, we can show you the adverts, we can show you this, we can show you everything. So you go, oh right, yeah, that works. That, you know, that, and that's.
What do you say, mate? And then most dentists will go like, "Oh, I'll go and do that myself."
Yeah, but it's not as easy as that. You see, it's not as easy as that.
Well, you haven't got the thing is you haven't got time.
You haven't got the time. You may say, "Oh yeah, I'll copy that and I'll do this," and it's like, well, go on then.
Yeah.
Because you've got all the AI part of it. You've got all the, you know, connecting the CRM to it all, and you know, we've got our own CRM. You've got the training for the TCO, you've got, well, go on then, you crack on it, you do it all, because it is a lot of work, a lot of time consuming, and we've done it so many times, we know how to do it and get the best from it, the quickness from it for our clients.
And the dentist should really be focusing on, like, if you segment
being a dentist.
Well, yeah, which is like the fulfillment part of like a small business. So you've got like the advertising, people coming in, like eventually seeing the dentist, and they should be focusing on that bit for like delivering the treatment and delivering the in-surgery experience. And then you've got like the aftercare for like getting testimonials, all that sort of bit. That should all be like the team already taking that. The dentist should be spending the time sort of focusing on delivering the dentistry.
It's very much also, I find, when we go into dentists, start working with them, it is, You're not. It's not. It's a, it's a growth as a team.
Yeah.
For you, the dentist, the front of desk, the nurses. You have to educate everyone on how to push it forward.
Yeah.
It's very important. That it's not. There's like I say, there's no I in team, is there? So
Yeah.
and that's what pushes the practice forward. All the AI, all the advertising, all the leads. But if the whole team isn't working together, then it's you're not going to get the benefits out. Yeah, you're going to get leads and more customer, but you're not going to get the true benefits out of it. That's why we call ourselves dental growth partners. We want to grow as partners with you as a dentist, as a practice.
Yeah, I think if you've got the right person who you trust sort of marketing the practice, it's really like a bolt
Yeah.
on the front end. Like it should be a sales and marketing machinery that you're sort of bolting on at the front, and you're then sort of not involved in that, dabbling in sort of programming ads and stuff.
Yeah.
You know, it should be doing treatment plans and like really wowing the patients, but you can ideally find someone who's going to look after that and you can trust them to look after it,
Yeah.
and that they're paying attention to it and that it's kind of working.
And the practice is growing as
Yeah,
well.
and then
more revenue and
yeah, and then that gives you that's like the, you know, in terms of reducing anxiety, that's a good place to be, is when you kind of like trusting them
trust,
to do
isn't
it.
it?
It's then you're confident to spend the money on the ads, but you're also confident that it's going to pay for itself,
Yes.
and then you're confident that you're kind of, yeah, you're being well looked after.
That's why we always say, like, it takes 3 months, 90 days, 3 months roughly, for you to be able to start seeing a good return. You may see it a lot quicker, but realistically, you need to be in on it for minimum of 3 months.
I think as a practice owner, obviously, I know a lot of other practices, etc. So there's sort of, if you want to, yeah, you sort of make a decision whether you want to be growing, and if you want to be growing, you have to sort of get an understanding of advertising and how it works and what levels it's kind of got to be done at to actually have a result. And if you don't do that, then you're essentially just committing to kind of turning over.
The same.
And I think that's kind of, in terms of it, like a professional education, it's like if you want to be growing and have a bigger influence, then it's important to kind of get understanding, get comfortable with what that takes.
Yeah.
And some people just don't want to do that, and that's fine. But if you do want to sort of grow a bigger team, grow like a bigger influence in your area, then actually advertising is
grow your practice.
one of the key skills.
Yeah, more monetize in your practice more. You know, get more revenue in. You know, everyone likes some extra revenue, don't they?
Yeah, and as I say, you want to be doing more of what you enjoy doing, and then also
Exactly,
if you want to have a team.
Playing golf. That's what
Well, ideally a bit of balance between the two. Really, it's like you want to be busy.
you don't want to be killing yourself, do you?
But,
That's the
yeah,
thing.
but you need
You'll
a
be
team
working smart.
in order to not be killing yourself. You need to be big enough that you
Yeah.
can delegate,
Yeah.
and that's the other thing in dental practices. You can get sort of up to a certain point where you're busy and you're kind of, you know, but you're too busy
Yeah.
on everything, and
Yeah.
you actually need to be able to delegate. You need to be actually a bit bigger, and this is where a lot of patients or a lot of practices get to, and then they sort of, they know they need some sort of change, but they're kind of like trying to figure it out, and it's kind of, it's part of the evolution, I guess, of understanding like how to run a practice is finding out about stuff, but then being comfortable to let someone else kind of take the lead on it. But yeah, I think that's been really like useful and like a sort of good understanding of like where Facebook advertising is now.
I mean, it's not an in-depth thing. It's not an in-depth, but it sort of like gives you a general sort of overview of what you should be doing, the different, you know, you won't go far wrong using the lead forms, and you won't go far wrong with running an awareness campaign as well. You know, you've got to spend minimum £25 to make those leads work for you. Don't go outside 7 kilometres, I say, normally, and yeah, you know, make sure you've got good visuals. Make sure you've got 3 different types of you know, advert, video, corporate, lifestyle, and invest in your team and work with a proper marketing company or individual, or you know, that type of thing. So
Yes.
I hope this has been a little bit of an eye opener or helped you with this different views from a dentist and a marketer sort of thing. you some ideas to move your practice forward. And don't forget, if you like this podcast that we do, please like the podcast. It helps us. If you've got any questions for us, please put them down below. We'd be more than happy to help you and answer any questions. And share it with your friends, your associates, your other principal dentists, things like that. But yeah, I look forward to, well, we both look forward to seeing you on the next podcast.
See you next time.